One of the most barbaric features of a society is the genital mutilation of its children. It's based on a medical dogma, sadly, that the normal, sometimes stressful experiences of boys and girls growing up is a pathology that requires medical intervention. Parents are told if they don't agree to these disfiguring and permanently sterilizing procedures, they're putting their child at increased risk of suicide, a baseless claim that has never been supported with good data. Let's be honest, and I'm going to say what you're not supposed to say. Pushing transgender ideology in children is predatory, it's wrong, and it needs to stop.
You just watched Robert F. Kennedy Jr. do what authoritarians have done throughout history when they seek to extinguish the vulnerable from public consciousness, framing care as mutilation and science as ideology, weaponizing the language of child protection to terrorize families who are simply trying to keep their children alive. And what you need to understand right now before we even get into the weeds of the research is that this isn't happening in a vacuum, because Health Secretary Robert F. Kennedy Jr. and Dr. Mehmet Oz announced moves Thursday that will have the effect of essentially banning gender-affirming care for transgender young people, even in states where it is still legal. The second proposed rule would block all Medicaid and Medicare funding for any services at hospitals that provide pediatric gender-affirming care, and because hospitals rely on Medicare, the rule would have a wide-ranging effect, meaning this administration is quite literally holding every hospital in America hostage to enforce its ideological war against transgender existence, because that's what this is, an ideological war dressed up in the stolen language of medical ethics and parental rights, and we need to be absolutely crystal clear about what's happening, because the stakes couldn't be higher for the most marginalized children in our society. Let's start with the most pernicious lie that Kennedy peddles in this clip, the claim that linking transition denial to suicide risk is, quote, baseless, and has never been supported with good data, which is such a staggering distortion of the scientific literature that it should disqualify him from holding any position of public health authority, because the research on this is overwhelming and devastating in its clarity. Gender-affirming medical interventions were associated with lower odds of depression and suicidality over 12 months, and these data add to existing evidence suggesting that gender-affirming care may be associated with improved well-being among transgender and non-binary youths over a short period, which is important given mental health disparities experienced by this population, particularly the high levels of self-harm and suicide. And that's just one study among dozens that tell the same story. Transgender and non-binary youths were found to have 60% lower odds of depression after receiving gender-affirming intervention, and when we're talking about suicide specifically, a recent study found that transgender adults who received pubertal suppression hormone therapy as adolescents were less likely to experience suicide ideation in their lifetime. And the protective factors go even deeper because transgender and non-binary youth who reported gender identity acceptance from at least one adult had 1/3 lower odds of reporting a past year suicide attempt, and acceptance from at least one peer was also associated with lower odds of a past year suicide attempt, which means that what Kennedy is doing right now by platforming this rhetoric of rejection and delegitimization is actively contributing to an environment that kills children, full stop. And I want you to sit with that for a moment, because when we talk about the violence of this administration's policies, we're not speaking metaphorically. And here's what makes this even more enraging. Kennedy claims we're dealing with genital mutilation happening to children on a mass scale, conjuring images of operating rooms filled with prepubescent kids undergoing irreversible surgeries, which is a complete fabrication designed to activate parental panic and justify state control over families. The reality documented by Harvard researchers is unambiguous. In this cross-sectional study of a national insured population in 2019, there were no gender-affirming procedures conducted on transgender and gender-diverse minors aged 12 years and younger, and procedures on transgender and gender-diverse minors older than 12 were rare and almost entirely chest-related procedures. And furthermore, a study found little to no utilization of gender-affirming surgeries by transgender and gender-diverse minors in the U.S., which means the entire premise of Kennedy's moral panic is empirically false. It's a lie manufactured to generate outrage that can then be channeled into legislative cruelty. And this is straight out of the fascist playbook where you create a phantom menace targeting children to justify unprecedented government intrusion into private medical decisions and family autonomy. Now Kennedy wants you to believe that the normal, sometimes stressful experiences of boys and girls growing up are being pathologized by an ideological medical establishment, as if gender dysphoria is just typical adolescent angst that woke doctors have decided requires pharmaceutical intervention, and this fundamentally misunderstands or deliberately misrepresents what gender dysphoria actually is and what the standard of care requires. Several studies have demonstrated the positive and potentially life-saving impact of gender-affirming medical care for transgender and gender-diverse youth, and the idea that doctors are just handing out puberty blockers like candy to confuse teenagers is belied by the actual protocols, which involve significant counseling and psychological assessment, with the World Professional Association for Transgender Health recommending extensive exploration of psychological, family, and social issues prior to any physical interventions for young people. So we're talking about a rigorous multidisciplinary process involving mental health professionals, endocrinologists, families, and the young people themselves, not some ideological assembly line converting gender nonconforming kids into medical patients. And the fact that Kennedy frames it that way tells you everything about his actual agenda here. And let's talk about what baseless actually means in the context of medical research, because Kennedy traffics in this rhetorical move where, if the evidence doesn't meet some impossibly high standard that he's invented, then it doesn't exist at all. Never mind that there is strong consensus among the most prominent medical organizations worldwide that evidence-based, gender-affirming care for transgender children and adolescents is medically necessary and appropriate, and transition-related health care for transgender people and youth is supported by every major medical association and leading health authority. And we're talking about the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, the American Psychological. But Kennedy, as HHS Secretary, has the audacity to dismiss decades of peer-reviewed research and clinical consensus as junk science, to quote the administration's own executive orders, which is exactly what you do when ideology trumps evidence and when your goal is elimination rather than care. The cruelty here is the point, and we need to name it as such because when a bill introduced by Rep. Marjorie Taylor Greene that makes it a crime to provide gender-affirming care to transgender minors, punishable by a fine or prison time of up to 10 years, passed the House on Wednesday, we're watching the criminalization of pediatric medicine. We're watching the state threaten doctors with a decade in prison for providing care that is supported by the entire medical establishment, care that reduces depression and suicidality, care that allows young people to become who they actually are, rather than who their assigned sex at birth demands they pretend to be. And this is happening alongside Trump's executive orders that denied the existence of transgender people and instructed government agencies to acknowledge a strict gender binary, which means the federal government is now in the business of deciding which identities are real and which are ideological constructs that must be stamped out. And if that doesn't terrify you, then you're not paying attention to how authoritarianism actually works in practice. What Kennedy is really saying when he claims that pushing transgender ideology in children is predatory is that transgender people are predators, that doctors who provide evidence-based care are groomers, that parents who support their children are abusers, and this language is designed to do one thing, which is to make transgender existence so stigmatized, so dangerous, so socially and legally untenable, that transgender people disappear from public life entirely. And we've seen this playbook before, because this is exactly how moral panics function throughout history. You take a vulnerable minority population, you associate them with harm to children, you whip up public hysteria, and then you use that manufactured crisis to justify whatever eliminations policies you wanted to enact in the first place. And the transgender community is currently living through a moment where a multi-year study found that the passing of anti-trans laws that resulted in the restriction to transgender care showed a direct link to negative mental health outcomes for transgender youth, with the study following the enactment of several laws in U.S. states which led to a 7 to 72% increase of suicide attempts in transgender youth, within 1 to 2 years following the enactment of laws restricting access. So we have empirical evidence that these laws kill kids, and the response from this administration is to double down and nationalize the cruelty. And I need you to understand the material consequences of what's happening right now, because this isn't abstract policy debate. A 2024 study of medical insurance claims found that there were no gender-affirming surgeries performed on transgender youth 12 and younger, and for older teens and adults, the rates of gender-affirming surgery with a trans or gender-diverse-related diagnosis were 2.1 per 100,000 and 5.3 per 100,000, respectively, which means we're talking about incredibly rare procedures performed on older adolescents after extensive evaluation. but Kennedy's rhetoric makes it sound like there's an epidemic of child mutilation happening across America, and this manufactured panic is being used to justify policies that will affect hundreds of thousands of young people, because the Trevor Project estimates that more than 1.8 million LGBTQ+ young people, ages 13 to 24, seriously consider suicide each year in the U.S., and the 2024 U.S. National Survey found that 39% of LGBTQ+ young people seriously considered attempting suicide in the past year, including roughly half of transgender and non-binary youth. And when you take away the one intervention that we know reduces that suicidality, when you tell families that keeping their children alive is now a criminal act, when you force doctors to choose between their medical ethics and their freedom, you are condemning young people to death and calling it child protection. The intellectual dishonesty here is staggering because Kennedy references good data as if he's operating from a position of scientific rigor, when in fact, HHS leaders cited their own review of evidence and reports from other countries, many of which have faced sharp criticism for drawing sweeping conclusions with little or poor evidence. And when the HHS report was released, HHS refused to identify who wrote it, and HHS said parts of it were peer-reviewed but would not disclose which parts or identify who reviewed it. So the administration is literally hiding the authorship and review process of the report it's using to justify stripping healthcare from vulnerable children, which is the opposite of scientific transparency and evidence-based policymaking. This is ideology masquerading as medicine. This is fascist science, where the conclusion is predetermined and the evidence is manufactured or cherry-picked or simply fabricated to support the desired outcome. And Kennedy has the gall to claim that the medical establishment is the one operating from dogma, when he's the one overriding decades of peer-reviewed research with an anonymous government document designed to justify predetermined political conclusions. Let's also sit with the eliminationist logic of what Kennedy is proposing, because when he says this needs to stop, he's not just talking about stopping surgeries that aren't happening to young children anyway, he's talking about stopping puberty blockers, which can be prescribed as a child reaches puberty, to pause unwanted physical effects of a puberty incongruent with one's gender identity. And research shows access to puberty blockers during adolescence is associated with a significant decrease in suicidal ideation, and doctors have used these medications safely for decades for cisgender children who experience precocious puberty. So these are medications with an established safety profile that are used routinely in pediatric endocrinology. But when they're used to help transgender kids, they suddenly become chemical castration in Kennedy's framing, which is both medically inaccurate and deliberately inflammatory. And the goal here isn't medical safety. The goal is to make it impossible for transgender young people to access any form of medical support for their identities, to force them through a puberty that causes profound distress and often permanent physical changes that increase dysphoria for the rest of their lives. And if some of them don't survive that forced suffering, then that's apparently an acceptable cost of this administration's ideological crusade. The broader context makes this even more sinister because, within hours of returning to power, President Trump issued an executive order that seeks to dismantle crucial protections for transgender people and denies the validity of gender identity itself, and the order pledges to withhold federal funding from any programs that promote gender ideology. The order directs HUD to repeal the Equal Access Rule, which protects LGBTQ+ people from discrimination in housing and has been in place since before the first Trump administration, and to promulgate a rule that prevents transgender women from being able to access domestic violence shelters, which means we're watching a systematic erasure of transgender people from every sphere of public life simultaneously: healthcare and housing and education and employment. And Kennedy's attack on gender-affirming care for youth is just one component of a much larger project of making transgender existence legally and socially impossible. And this is what eliminationism looks like in a modern democracy. You don't need concentration camps when you can simply legislate people out of existence by denying them healthcare and housing and legal recognition and access to public spaces, until they either flee to more hospitable jurisdictions or stop existing as their authentic selves, or literally die. And those are the only options this administration is leaving for transgender people, especially transgender youth. And we need to talk about the class dimensions of this, because the first proposed rule would prohibit doctors and hospitals from receiving federal Medicaid reimbursement for gender-affirming care provided to transgender patients younger than age 18. And Medicaid is the healthcare program that covers low-income Americans, which means the families who will be hit hardest by these policies are those who are already marginalized by poverty, disproportionately Black and brown families, families in rural areas, families without the resources to travel to blue states or pay out of pocket for care. And this is always how oppression operates. The wealthy will find ways to access care for their children, whether it's legal or not, but poor and working-class families will watch their children suffer and die because the state has decided that their existence is ideological rather than real. And the cruelty is compounded by the fact that data indicate that 82% of transgender individuals have considered killing themselves and 40% have attempted suicide, with suicidality highest among transgender youth. So we're talking about a population that is already experiencing catastrophic rates of suicidality, and the government's response is to take away the one intervention that reduces it, which is either staggering incompetence or deliberate malice. And given everything else this administration is doing, I'm going with malice. The framing of protecting children is particularly obscene because what actually protects children is listening to them, believing them, providing them with evidence-based medical care in consultation with qualified professionals and their families. Many of the mental health challenges faced by transgender and gender-diverse youth are not intrinsic to their being transgender, but rather likely reflect lack of societal acceptance, and notably transgender and gender-diverse youth presenting for gender-affirming medical care at earlier pubertal stages demonstrated better mental health and sense of well-being at baseline compared to older adolescents presenting at later pubertal stages, pointing to the potential benefits of gender-affirming medical treatment earlier in life, which means the harm isn't coming from being transgender or from accessing care. The harm is coming from stigma and rejection and barriers to care. The harm is coming from politicians like Kennedy who tell these kids that their identities are delusions, and their doctors are predators and their parents are abusers. The harm is coming from a society that would rather see them dead than trans, and every piece of research confirms this. But it doesn't matter because the goal isn't protecting children. The goal is enforcing a rigid gender binary and punishing anyone who transgresses it. We also need to recognize that this attack on transgender healthcare is part of a broader assault on bodily autonomy and medical privacy that should concern everyone, regardless of whether you're personally affected, because the principle that the government can override medical consensus and criminalize evidence-based care based on ideological objections is exactly the same principle that's being used to ban abortion. And if the state can tell transgender kids they're not allowed to access puberty blockers and hormone therapy, the state can tell anyone they're not allowed to access any medical intervention that conflicts with the ruling party's moral framework. And this is why we've seen gender-affirming care for youth become a growing target for state governments, with as of March 27 states having enacted restrictions on such care, meaning about 40% of trans youth live in a state with limited gender-affirming healthcare options. And this patchwork of care is creating a refugee crisis where families are being forced to uproot their lives and move to states where their children can access medical care. And for families without the means to relocate, that means watching their children suffer, and the psychological toll of that on both the young people and their families is incalculable. And I keep coming back to Kennedy's claim that linking care to suicide prevention is baseless, because it's such a revealing lie. It's the kind of lie you tell when you need to preemptively discredit the evidence that undermines your entire argument, and the evidence is overwhelming. Transgender high school students were 30% more likely than non-transgender students to report attempting suicide at least once in the past 12 months, and in a sample of 84 transgender youth, those that reported being strongly supported by their parents had a 93% lower suicide attempt rate, a 14-fold difference, which means parental support is literally the difference between life and death for these kids. And what Kennedy is doing is telling parents that supporting their transgender children is abuse, that helping them access care is mutilation, that the loving thing to do is to force them to conform to their assigned sex regardless of the psychological cost, and this is a recipe for family rupture and childhood trauma and ultimately death. And he knows it, they all know it, but transgender lives are expendable in service of the broader political project of enforcing traditional gender norms and rolling back LGBTQ rights. The medical consensus on this is not ambiguous. There is strong consensus among the most prominent medical organizations worldwide that evidence-based, gender-affirming care for transgender children and adolescents is medically necessary and appropriate. Major medical organizations, including the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, the American Medical Association, the American Psychological Association, and the American Psychiatric Association, have published policy statements and guidelines on how to provide age-appropriate gender-affirming care, and all of those medical societies find such care to be evidence-based and medically necessary. So when Kennedy dismisses this as ideology or junk science, what he's really saying is that he knows better than every major medical organization in the country, that his political convictions override decades of clinical research and practice, that children should die to prove his ideological point, And this is what happens when fascist thinking captures public health institutions. Evidence and expertise become obstacles to be overcome rather than guides to be followed, and the consequences are measured in dead children. And here's the thing that should terrify every parent regardless of their politics. Once the government has established that it can override parental decision-making and medical expertise based on ideological grounds, once it's criminalized doctors for providing evidence-based care, there is no limiting principle. There's nothing stopping them from deciding that your child's medical needs are also ideological and therefore subject to government veto. And this is already happening with abortion, where state legislatures are forcing people to carry non-viable pregnancies to term because the religious right has decided that's what God wants. And now it's happening with transgender healthcare, where the government is forcing kids through unwanted puberties because the conservative movement has decided that gender diversity is an ideology rather than a human reality, and tomorrow it will be something else. Maybe it's ADHD medications or antidepressants or any other intervention that can be framed as drugging children by people with an ideological axe to grind, and by the time you realize your family is affected, it will be too late, because the mechanisms of state control will already be in place. The predatory framing is especially pernicious because it invokes centuries of bigotry that has portrayed queer and trans people as threats to children, as groomers and molesters and corruptors of innocent youth, and this rhetoric has always been deployed to justify violence against LGBTQ people, and Kennedy is reviving it now with the full authority of the federal government behind him. And when the Secretary of Health and Human Services says that providing health care to transgender youth is predatory, he is giving permission for harassment and discrimination and violence against transgender people and the medical professionals who care for them. He is painting targets on their backs and calling it child protection. And we're already seeing the consequences with the White House announcing layoffs, impacting more than 1,100 employees at the Centers for Disease Control and Prevention, resulting in the elimination of entire departments, with one employee stating that the administration dismantled the Office of Population Affairs, which oversaw LGBTQ health initiatives and other reproductive health services. So they're not just blocking care, they're destroying the infrastructure that researches and supports LGBTQ health. They're erasing decades of hard-won progress and institutional knowledge, and this is scorched earth stuff. This is ensuring that even when this administration is gone, the damage will take generations to repair. What we're witnessing is a systematic campaign to make transgender children invisible through a combination of legal erasure, medical gatekeeping, and social stigmatization, and it's working. 71% of LGBTQ adults expect Trump's policies to have a negative impact on those who are gay, lesbian, or bisexual. And the number is even higher for transgender people. And this isn't paranoia. This is a rational response to an administration that has made eliminating transgender existence a core policy priority. And when you're a transgender kid watching the federal government debate whether you should be allowed to exist, when you're seeing adults with power and authority describe your very identity as predatory ideology, when you're living in a state where accessing the healthcare you need could result in your parents being investigated for child abuse, the message is clear. You are not wanted. You are not valid. You would be better off dead than trans. And is it any wonder that suicide rates are catastrophic when that's the message being sent by the most powerful people in society? The path forward requires us to be absolutely clear about what's happening, and to build resistance at every level. We need litigation to block these unconstitutional policies. We need state and local governments to refuse cooperation with federal enforcement. We need medical organizations to stand firm behind their members who provide evidence-based care. We need families and communities to create networks of support and mutual aid for transgender youth who are being targeted. And we need a political movement that understands this assault on transgender rights as part of a broader authoritarian project that threatens everyone's freedom, because today it's transgender kids, tomorrow it's your kids, and the mechanisms of control being built right now will be turned against every vulnerable population in this country until we rise up collectively and say enough. The research is clear. The medical consensus is clear. The moral imperative is clear. Transgender young people deserve to live, deserve to access healthcare, deserve to be supported by their families and communities and government, and anyone who stands in the way of that is complicit in their suffering and death, and we need to name that clearly and fight it with everything we have, because children's lives are on the line, and history will judge us by how we respond to this moment of crisis.